injectable anesthetics that you'd like to be familiar with. Lidocaine, also known as Xylocaine, that's its trade name, is the most often used one for anesthetizing wounds before you close them with sutures. 1% lidocaine is the most commonly used. 2% lidocaine is used for digital block. Lidocaine with epinephrine, you can see here with the red label, is only to be used in certain parts of the body. When you inject lidocaine with epinephrine into an area like that that's bleeding, the skin edges will turn white and stop bleeding. This will help you close the wound. If it's a wound on the arm or leg, it's usually okay to use, and it comes in a 1% concentration. Another medication called Marcaine comes in a 0.25 and a 5%, and it's useful if you want to extend the analgesia to, say, 6 hours or so. Lidocaine will begin working within 5 minutes and usually lasts up to 2 hours, whereas Marcaine won't begin working until at least 30 minutes after it's injected. This limits its use as a sole anesthetic, and usually what we do, if we want prolonged analgesia, say 5 minutes to 6 hours, is we'll mix in a 50-50 ratio lidocaine in either 1 or 2% with Marcaine, 0.5 or 0.25%. If we have bleeding and it's a safe area to use, we can inject lidocaine with epinephrine. This will help slow down the bleeding and also create a white area around the injection site. And by looking at that white area, you can tell that that area is already numb and it's safe to put a suture in and the person won't feel it. You'd want to use a large needle, like this 18 gauge needle, to draw the medicine out of a bottle, especially a large bottle like this. If you use a small needle, like a 25 gauge needle, you'll spend forever trying to draw it up from a bottle because of its small bore size. So what we generally do is use a large bore needle, like an 18 gauge needle, to draw the medicine up, and then a 25 gauge needle to actually use to inject the patient. And they're switched out after drawing by using a luer lock syringe. You'll see at the end of this syringe that there'll be a hub where the needle will hook into the syringe and keep it tight. In order to drop the medication, we'll first take our bottle and clean it with an alcohol swab. This will kill most of the bacteria on the rubber stopper. Then we'll find a syringe, a 5 or 10 cc syringe, and affix it to our 18 gauge needle. If the bottle is a glass bottle, as this one is, we'll have to inject the same amount of air as cc's of fluid that we are going to remove. Otherwise, we'll create a vacuum. Once I've filled the syringe, I'm going to remove the 18 gauge needle and put on the smaller bore 25 gauge needle that we'll use to inject the patient's wound. If the multi-dose vial that we're withdrawing from already has a protective plastic cap on top and you flip it off for the first time, then you don't need to cleanse the top with alcohol. You only cleanse with alcohol when you're using it a second or a third time later on down the road. This is the difference between multi-dose vials and single-dose vials. Smaller vials are usually marked single dose, and what that means is that you can only use them once and then have to discard them. For the prepper, it's much easier to have multi-dose vials, large 50 ml vials like this one, that can be used over and over again. I think our patient is about thawed out here, and we've made a linear incision. This simulates a laceration that may occur in the field, and we're going to numb up the skin edges with lidocaine. We have a 25 gauge needle and a 5 cc syringe full with 1% lidocaine. The trick is to start at the very edge and the most proximal area. That way when you inject, and I'm slowly injecting, perhaps you can see a wheal forming. This is where the fluid is forming up under the skin. If you inject that this way and then march forward, you can see that you will only be placing the needle inside areas that are already numbed up, and thus the person won't feel the needle stick but once. Do You see how it puffs up? Now, if you're using lidocaine with epinephrine, this entire area will become white because it's closed down the blood supply there. And that's how it helps stop the bleeding process from the skin edges. Next, we'll repeat the process on this side, marching up one after the other so that the patient does not feel but one injection. If we use lidocaine with epinephrine, we'll note that this entire area on both sides is white, and it will also be numb when we test it. Once it's numb, once it's white, you're ready to start your laceration repair.